Hi, my name is Matt Woods, and welcome to HIPAA Simplified. Today we will talk about how to put together your risk mitigation plans. And so there are 7 core plans that come as a result of this risk assessment. And the first plan is your disaster recovery plan. And so in the event of a disaster, HIPAA mandates that you have some plan that outlines how you are going to recover that data. So what person is going to be in charge of it, and what is that person going to do in the order that they're going to do it. That all has to be documented out, and every single person that is mentioned in that plan has to be aware of their responsibilities in the plan, and that has to be logged. The second plan that you need to have is your emergency mode operation plan and your emergency access plan. And so what these plans outline is, in the event of an emergency, what staff are going to be responsible for giving you access to your protected health information, but also ensuring that all of your security protocols still take place. And so just because a tornado happens or a riot occurs in your town, it doesn't give you an excuse to not have access and not protect your files. And so you need to have an emergency plan that outlines all of those steps. The next major plan that you need to have is a contingency plan. And a contingency plan is in the event that a breach occurs, so someone hacks into your system or a laptop is stolen, what steps are you going to take to mitigate that risk? But not only mitigate the risk, but you also have to investigate the risk and then create a report that you send to the Department of Health and Human Services. And so you need to have all of that outlined and written down ahead of time, so that way when a breach happens, you can react as quick as possible to mitigate that risk from spreading to anyone else's files. After your contingency plan, you need to have a facility security plan. And so what this plan does is it starts at your front door, and then beginning at your front door, walking all the way through your practice, you have to identify everywhere where protected health information is stored and what you're going to do at each location to secure that information. So this could include installing security cameras, access controls, and locks on doors, and also locks on certain computers and servers that may be in a public space. And then after you've done your facility security plan, you need to document a disposal plan. We all know that technology gets old and outdated very quickly, and we have to get new computers or new printers or new copiers. But all of those machines now have hard drives in them, which means they're storing protected health information. And so when you're disposing of those computers, printers, and copiers, you need to have a plan of who's going to access those computers, those printers, and copiers, and delete all of that information. Not doing so and getting rid of those computers, copiers could lead to major fines. There was one hospital that got rid of their copier at the end of a lease, but when they did that, they sent it back to a company. One of those company's technicians grabbed the hard drive and then leaked all of those protected health information files onto the black market. It was a major leak that cost that hospital over $2 million for something that, if they just would have had a disposal plan in place, the employee would have known all the steps that needed to be taken before sending that back to the copier, and they would have protected their hospital and their patients from that major leak. In addition to a disposal plan, you also need to have an employee termination plan. No one wants to have to fire somebody from their company, but when they do, we need to make sure that we're protecting the company and the patient from any anger that may come from the employee. And so by having a termination plan that outlines the steps of who needs to know and in what order they need to know, you can make sure to secure your network from that employee before the termination occurs to protect your practice. And then the final plan or review that you have to do is your information system review. And so you need to document how you are going to do all of your information audits. And so HIPAA mandates that on a regular basis, someone from your company goes through all of your protected health information files to ensure that they are still maintaining their integrity and their accessibility. And so you need to have all of those steps documented and part of your risk assessment. We would love to partner with you to help you develop your risk assessment and all of your necessary plans. And to do that, we would work with you as well as introduce you to one of our partners, PCI HIPAA. Together, we would be able to develop the necessary physical, administrative, and technical safeguards that you need to protect your company against any HIPAA violations.